The cervix doesn't have nerve endings, so it's not going to feel anything during this procedure, is what I was taught in my OBGYN residency. I was not taught anything about pain control during IUD insertions, and I graduated in 2021. And I've thought a lot about how did my field get to this point where we were not recognizing that some people have pain during these procedures. When IUDs first came on the market about 50 years ago, they were indicated only for women who had had children. There was concern that this could cause infertility or infection, so they said if you've already had a child, you can get an IUD. From professional and personal experience, people who've had babies, especially recently, really don't feel a lot during IUD insertions. I myself felt absolutely nothing, including the tenaculum. So I think as a field, everyone was like, oh, no, like people don't feel IUD insertions. Like the cervix doesn't have nerve endings, not a problem. And then as the indications for IUD use changed and we started placing them in people who hadn't had children, those people's cervixes felt a lot of things. And then my field didn't pay attention and didn't listen and didn't as quickly address pain management for all patient populations. So that's why I, someone who was trained in the last 10 years, was never taught about pain control because it just perpetuates throughout training. I didn't start learning about it until I was watching social media and learning from other doctors who talked about it. Thankfully now we do have our major organizations like ACOG and the AAFP who has put out guidelines so that everyone understands that people deserve pain control, here are the options for pain control, and it's the standard of care to offer that pain control. But I think historically, initially, there was good reasons why people thought this, and then there was not good reasons why we didn't address it quick enough.